Hi, and welcome to the show. My name is Patrice. You're watching Chatting with Patrice. Today's guest is Kelly Barisha. Hi, Kelly Barisha, and welcome to my show. How are you doing?
Good. Good morning. Thanks for having me.
I'm glad to have you here. Can you tell our viewers what the forensic nursing program that you guys have going on at Oakland University, what is it all about?
Sure, yes. So Oakland University and the School of Nursing is happy to be offering a forensic nursing program starting this fall. It's the first program in the state of Michigan and only about one of a few in the country. So we're really excited to be offering the program. And so specifically about forensic nursing nursing is nursing practice when healthcare and the legal system intersect. So from a healthcare perspective, and as a nurse, I see patients all the time who come in who might have injury. So physical injury like a bruise, a broken bone, a laceration, or a psychological injury. Maybe they're in shock from their experience or they're having anxiety or depression. But what makes them unique, what makes them a forensic patient, is that the injury that they have is a result of them either being a victim or a perpetrator of a violent act or a crime. And so until suspicion of abuse or liability is ruled out, they are considered a forensic case. And because of that, law enforcement might become involved. So when healthcare and legal system intersect is where forensic nursing lies.
Okay. So when you say that they may be a perpetrator or a victim of a crime that has been committed, you mean like a rape or abuse, someone may have beaten them, or can you speak a little bit more about that?
Yeah. So I actually am a forensic nurse examiner, and I mainly care for patients who are victims of sexual violence or interpersonal violence. And so I think a lot of people think that specifically what forensic nurses do, take care of rape victims, which we do.
Okay.
But that's a very important part, but it's also only one part of what forensic nurses can do. So as you said, oftentimes we take care of patients who are victims of sexual violence or perpetrators of sexual violence, interpersonal violence, child and elder maltreatment. We will also take care of patients who are victims from man-made or natural disaster. So for example, the Boston City Marathon bombing, acts of terrorism where people are hurt, and those kinds of incidents would be a forensic case. Natural disaster like tornadoes, hurricanes, floods. Forensic nurses also work in correctional centers, so take care of patients who are also incarcerated.
Okay.
We will also work for law enforcement agencies or attorneys' offices and do chart reviews for acts of negligence. So it's very, very broad, actually.
Wow, that's wonderful. You know, I thought that it was such a great idea. I had a doctor's appointment the 7th, as a matter of fact, of this month, and the lady that came in to take my weight and all those things for me, my temperature and things, she asked me, and the last question she asked me was, "Are you safe in your home?" And I kind of thought, wow, I love that. And I asked her, I said, well, do you guys ask this of just adults, or do you ask it when you see children as well? And they say we ask everybody. And I thought, wow, that's fantastic.
That's great to hear, because I know for myself, I've never been asked that question. And I know from previously working in a hospital, we have maybe 3 small questions where we ask, do you feel safe in your relationship? Do you feel safe going home? And things of that nature. And I think a lot of times healthcare providers don't feel comfortable asking those questions because they are very personal and private. And so they're nervous about intruding on someone's privacy. And a lot of times I think, though, even if they do ask those questions, maybe the person doesn't feel comfortable or ready to answer that question honestly.
Yes.
But asking the question is the first step. But I think it's important that once you ask that question, as healthcare providers, we have to be conscientious about maybe circling back to that question when our patient feels more comfortable with us, because we know that while 1 in 5 women report having been raped in their life, and 80% being before the age of 25.
Yes.
They say 1 in 4 women and 1 in 7 men are victims of severe physical abuse from an intimate partner. We know those numbers are probably much higher because most people don't feel comfortable disclosing or reporting their victimization. So healthcare providers and nurses are a great resource to be able to reach out to people and ask those questions. And that's one of the things about our forensic nursing program, is that we are training nurses on ways to be able to assess and evaluate if violence is occurring. Because a lot of times what people say, they're verbals, and then they're nonverbals about what they're not saying, the way that their body language is speaking.
Yes.
We might have those cues, and it's very important to train nurses to be able to not only recognize signs and symptoms of violence, but to be able to care for them and offer the appropriate resources, and that's what our program at Oakland is offering.
Wonderful. Why is this specialized form of nursing important? Why do you think it's important?
So the statistics that we just went over, there's high victimization levels of sexual violence and interpersonal violence. And it's not just violence with sexual and interpersonal. Forensic nurses are also trained in death investigations. So the murders that are happening in our country, the acts of man-made and natural disaster that are occurring in our country, these are all situations that forensic nurses can intervene in. But it requires specialized education and training. I didn't receive any type of forensic training in my undergraduate or my graduate nursing school. This is not education and training that's readily provided to our nurses. I had to travel all over the country to piecemeal together my education. I've been in Chicago, I've been in California, Arizona, Florida, St. Louis. And so most nurses don't have that ability to travel the country and try to get a comprehensive forensic nursing education. I've been very fortunate that Oakland University has supported me in that, but that's what we are now offering to nurses in our community, a comprehensive forensic nursing education that provides you with this specialized training to be able to take care of victims of intentional and unintentional violence and trauma. They don't have to now go try to search for it all over the country. It's right here in their backyard. And so, as I said, nurses aren't trained in nursing school to be able to take care of this very specialized patient population. Not just, it's very different when you're talking to a victim of violence, how you communicate with them, and being able to identify wounds and injury, being able to document what we're seeing, and then also, very importantly, and this is a unique piece to forensic nursing, is being able to collect evidence. So things like DNA, blood, bodily fluids, foreign hair fibers, foreign bodies, and being able to see how they may have caused injury or how they may be related to a crime. And so that's something that we definitely don't cover in nursing school. And so this education is very important.
Awesome. What was the process to get this program approved on campus by the state?
So we've been working on this program for about 3 years, and it was just approved in the last couple months. So it's not something that was entered into lightly or passed readily, but we spent a lot of time researching because, as I said before, people who have heard of forensic nursing most commonly associate it with sexual assault survivors and being able to care for victims of sexual assault. And so we did a lot of research about what forensic nursing is. And so that took a lot of time. We also surveyed our community of interest. Were students going to be interested in this program? And out of about 400 nurses that responded to our survey, about 60% said they were interested in this education. We also surveyed people in positions of hiring to determine if this education was something that our employers would want. Same thing, about 60% of people that responded said an education in forensic nursing would be something that would increase likelihood of hiring. We had to garner support from our community. So we work very closely with Haven of Oakland County, Wayne County SAFE, and Turning Point of Macomb County. Those are the community-based forensic nursing agencies. we had to garner support on campus. So our School of Medicine, our School of Criminal Justice, our OU Police Department. And so we worked really hard to get that support. And I wouldn't say most importantly, but very importantly, we have the support of Virginia Lynch, who is the founder of Forensic Nursing.
Wow.
And so
that's incredible.
She has readily endorsed our program as the forensic nursing program of her choice. And so we're very proud to have her supporting our program. Moving on from there, we had to go through all the different channels of approval. So through the School of Nursing, Graduate Studies, Senate, the Board of Trustees, the President's Council.
Jeez.
And so 3 years later, here we are today being able to offer our program.
Well, congratulations.
Thank you.
How long is the program?
So we offer 2 different tracks. We have a Master's of Science in Forensic Nursing, and then the other option we offer is a graduate certificate in forensic nursing. So they're both at the post-bachelor's level, so it would be nursing. It has to be a nurse who has her bachelor's degree.
Okay.
And so he or she, they could choose to do the master's program, which is 38 credits, and it is over 28 months. So it's about, I want to say it's fall, winter, summer, fall. So 6 semesters, 28 months, and they would exit having their master's degree and be able to use the credentials of MSN. And then the other option is our graduate certificate. That is 16 months, and it is 18 credits. It's 4 semesters. And so the difference between the two is about 5 classes. The master's degree, obviously, you'll have the title of MSN when you exit. And that is important because graduate level education is extremely important to advance the professional practice of nurses. With your master's degree, you can teach, you can work in administration, and you can serve as a leader in the specialty of nursing. With your graduate certificate, that's also important because if you're working in the emergency room or you're working in a women's health unit or you're working in peds or gero, you might be seeing these forensic patients on a day-to-day basis, but you've never received the appropriate education for that. So the certificate would give you that level of education that you don't currently have. And so the courses that make up our forensics program, the specialty, are, we have a foundations course all about the science of forensic nursing. We have emergency preparedness and disaster management. We have sexual violence, interpersonal violence, child and elder maltreatment, and then we have a death investigation course. We wrap that up with a advanced forensic seminar and clinical that allows the nursing student to work one-on-one with either a forensic nurse, an advanced practice nurse, or physician, and whatever of the subspecialties within forensic nursing that they might want to pursue.
Okay. Now, how many students will you accept for the fall, which will be the first year for the program, right?
Right, and so we're very humble in what we were hoping to start out with. We can run the program with this view as around 10 students, and we're at about that right now as far as interest. But we could run up to around 20 to 25 students successfully. So we're hoping somewhere in that 10 to 20 student range to start off with.
Okay, great. And so once the students graduate from the program, then they can work where, like, in any form, anywhere, nurses, prisons, where would they be able to work at? Yeah,
that's a very good question. So I think what's important to note is forensic nursing is a growing specialty. Okay. It's growing. And when I go and do my forensic talks to groups of nurses and I say, how many people have heard of forensic nursing? Maybe a quarter of the room raises their hand. And so part of our responsibility is to educate our community, our healthcare providers, and everyone that we work with what forensic nurses do so that they can be taken to their full advantage.
Yes.
And so there's a couple different things. So forensic nurses might stay in the same job that they're currently at, having now have education that will benefit them in their current role. So some nurses might want to stay right where they're at. Nurses that are going out and saying, I want a forensic nursing job. When they Google that, or when they look in the Sunday paper, or they go and look at job postings at hospitals, something that says hiring a forensic nurse, that's going to be the minority.
Okay.
There's not a lot of jobs that say hiring a forensic nurse, unless you're going to, for example, Haven or Turning Point or Wayne County Safe. Those are forensic nursing agencies. That will definitely say hiring a forensic nurse. So some nurses might want to take on a role like that. But what I was saying about educating nurses in our community is there's so many nursing jobs that have forensic implications, and this forensic education will set you above and apart other nurses going for that job. So as you mentioned, Patrice, healthcare providers in hospitals. So if you're going to work in a peds unit, pediatric unit, a gerontologic unit with our elderly patients, a women's health unit, or the emergency department, you're seeing forensic patients on a regular basis. As you said, going to a correctional center, getting a job in a government agency, for example, maybe the military or the Department of Human Health and Services, a law enforcement agency, or a law firm as a legal nurse consultant. Forensic nursing has basis in public health, so maybe a public health position. So there are many, many positions that are forensically based, and this education would put you in a very important position. And one last thing that I would want to mention is in a recent survey, there were close to 1,700 open faculty positions in over 600 schools of nursing.
Wow.
So an extreme faculty shortage. So the need for nurses who have graduate level education with your master's degree is very significant. But what's even more important is that what they found was the open faculty positions, the biggest gap were in nurses who could teach specialties. So for example, forensic nursing as a specialty. So we really need nurses graduating from our program with their master's degree who can not only serve as educators and leaders, but serve as educators at Oakland University and be able to teach future generations of forensic nurses. So we just feel very fortunate to be kind of on the cusp of this new endeavor where forensic nursing is just exploding and the needs are going to be so great. And so we really need nurses not just to be forensic nurses, but to be educators who can teach these nurses.
Absolutely. I've heard you speak a couple times about Turning Point. So you guys do work closely with Turning Point?
The three, so we work closely all the time with our fellow healthcare providers in Wayne County and Oakland County and Macomb County. Especially Oakland, we have many off-site facilities in Oakland County and in Macomb County. And so yes, Turning Point is the Macomb County-based forensic nursing agency. And not just forensic nursing, but they have the shelter services, they have social work, they have psychiatric services.
Yes.
And so that's for Macomb County. Haven has all of that in Oakland County, and then Wayne County Safe is in Wayne County. So yes, we work with all of them very closely.
It's amazing that you said that because I'm going to be having some ladies from Turning Point on my show on the 28th of this month. So I'm excited about that as well. That's a great organization, Turning Point.
It is.
I love it.
It is. One of the things we've been doing recently with them is we have graduate students completing their doctorate and their master's, and they're completing their final research projects and working with the women and children who are residents in the shelter to provide them with healthcare needs that they need while they're sheltered. And so, you know, our forensic nursing program is one small piece of the puzzle. We're trying to do a lot of things out in the community and on our campus as well. We recognize that there's so much need. There's so much need, and you can always do more and more and more.
You can never do it. You can never do enough. And I love Oakland too. Oakland University is like, oh my God, I love it. Huge.
Oh, thanks.
But I love it. I get lost sometimes at school. I'm like, okay, where am I?
Yeah, it's a wonderful, wonderful facility.
It is. It's a wonderful facility. What is the website and phone number for people to use if they wanted to get in contact with someone in regards of the program?
They can visit www.oakland.nursing.edu, and that's our School of Nursing webpage. The forensic information is right there on our School of Nursing homepage, as well as all of our other wonderful programs, including we have Masters in Nursing for nurse practitioners as well as nurse anesthesia. We also have a Doctorate of Nursing Practice program along with our undergraduate programming, but they can visit our School of Nursing webpage. We have flyers available that goes over all of the program requirements that we kind of discussed, the credit allocation, the different courses that are involved, and most importantly, how they can apply to the program. I'm actually the program coordinator for the forensic nursing program, so they can always contact me at any time. My email is my last name, Barishai, at oakland.edu, and then they can contact my number, which is 248-364-8750, and I'm always happy to provide any information for anyone who's interested.
Okay, great. It's good to know. Thank you for the information.
You're welcome.
Now, in addition to the forensic nursing program, you also work with the Oakland Violence Protection.
The Oakland University Violence Prevention Task Force. We started that about 3 years ago, and kind of what I was telling you is it's not just about us training nurses to be forensic nurses. We realize that we want to be involved at a community and at a campus level. And so the Violence Prevention Task Force, myself, and I work with a great group of faculty, Dr. Margaret Glembaki, Kimberly Holka, and Stephanie Valley from the School of Nursing. Kim and I went to Haven, and we said, what could you help us to do on campus? And their education and prevention team has just been wonderful to us. I work with a gentleman named Cole Wykus very closely, and so he helped us to start this task force. And so we have members all across campus that have joined us now, from Gender and Sexuality, from the OUPD, from the Center for Student Activities, and the biggest endeavor that came out of our organization, we now call it Redefine. And Redefine is a program that Haven of Oakland County puts on. It's a bystander intervention training. And so we are going to be starting our third year doing a bystander intervention program, which we now call Redefine. We've trained close to 200 students in bystander intervention. It's a 6-week leadership training where they come once a week for about 2 hours, and we teach them about consent. We teach them about gender norms. We teach them about how we interact with people of the same sex and opposite sex. And we teach them about how to intervene safely to prevent gender-based violence from occurring. And so the forensic nursing program, a lot of the times we're taking care of people who have already been injured. But what Redefine and bystander intervention does is stop people from ever being injured, stop them from ever being assaulted. And so
that's remarkable.
We're teaching people how to interact with each other in a really healthy and positive way, and then if you see something happening, how to safely stop that from occurring. And so we've trained almost 200 students in the general population, and Cole and Haven are working with our athletes, they're working with our student leaders in student congress, and so they're having a really great impact on campus. I'm just the facilitator. Haven is the one providing that very important information. So we're just really proud of what we're been able to do so far.
That's great. That's great. It's always good to hear people working and doing what they were put on this earth to do, to serve, to be of service of some type. And I think when you get that, you get what life is all about. You just have to figure out where you're supposed to be and what you're supposed to be doing, and it's in service.
I think you're just right about that, though. You know, you're going around long and you're doing your job, and then all of a sudden something happens one day, and then you're like, this is definitely what I'm supposed to be doing. Yep.
Yes. Okay, last but not least, you were instructed to help in Oakland University for a new student organization called Grizzlies Against Violence. What are the goals and aspirations of this student group?
So the Violence Prevention Task Force that we were talking about is a university-based group. However, we welcome partners from the community as well. So the Violence Prevention Task Force has all members across campus, and it's mainly faculty and staff. We didn't have a great student representation on that group, and really that's what drives everything. That's what makes change. That's what gets people motivated. are the students. And so we had some really, really great students. Kevin Romanchik, Stephanie Thomas, Caitlin McGeechee, and Christina Schneikowski. Those are our 4 students that struck out on their own, and they did the hard work that was necessary to start a student branch of the Violence Prevention Task Force, and it's called Grizzlies Against Violence. They just formed this group, and their mission and goals are similar to that of the Violence Prevention Task Force in preventing gender-based violence. And it's all about prevention. And so they're specifically students. They're only made up of students, and they're offering it to alumni as well. But they participated. They made 1,000 teal ribbons a couple weeks ago. April was Sexual Assault Awareness Month. So they tabled in the Oakland Center and passed out all of these teal ribbons. They participated with us in Take Back the Night, which was a rally on campus to bring awareness to our sexual violence and our survivors. They have been really great about getting the word out there about the programming that we're doing. And so if you are a member of Oakland University, we highly encourage you to participate in Grizzlies Against Violence. Or if you're a member of Oakland community and want to get involved, the Violence Prevention Task Force would be something you could participate in. Both of those orgs you can find information about on the School of Nursing website at Oakland, or contact me as well. And we're always looking for more members. So
great, wonderful. Thank you so very much for stopping by,
thank
Callie.
you for having me.
Great
really
show.
appreciate it. Thank
Appreciate
you.
you.
Thank
Commend
you so
you
much.
for everything that you do. Keep doing what you do.
You
Thank
too.
so much.
Thank you so much.
Thanks for watching, and have a great day, everybody.